Swadika, welcome to Thailand 2020. I am Tulip Naksompop. This program will take a look into every aspect of Thailand's future. World Health Organization has praised Thailand for the effort on universal healthcare scheme, says that the country has long, successful history of healthcare development, introducing the universal healthcare for the Thai citizens since 2002. Thailand reformed its public health financing system in 2002, extended the scope of coverage to 18 million people who were uninsured and to a further 29 million people who were previously covered by less comprehensive schemes. The project has been over 25 years in the making, starting with a social welfare scheme for the poor in 1975. The new scheme offered comprehensive health care that include not just basics, such as free prescription drugs, outpatient care, hospitalization and disease prevention, but more expensive medical services such as radiotherapy, surgery, and critical care for accidents and emergencies. Health and medical care in the country is overseen by the Ministry of Public Health, along with several other non-ministerial government agencies, with total national expenditure on health amounting to 4.3% of the GDP in 2009. Quality and universal security for all Thais is a main goal of the 11th National Development Plan 2012 to 2016. Almost all health-related Millennium Development Goals have been achieved at the national level, but disparities remain. The poverty rate is still 4 to 8 times greater in some regions when compared to Bangkok. And today we would like to welcome the Director of Sirat Hospital, Dr. Visit Wamwanmit, to the program. Swadika. Thank you very much. We have been discussing about the private hospital and public hospital in general. Now today we're going to talk about the social security system or social welfare. Can you tell us the background of the Thai public health system a little bit?
Well, if we look at the population of Thailand, let's say 100% of the people, we can now say that almost every people has the coverage by the universal policy,
right,
what we call UC.
Right.
So basically, if you don't have any coverage, you will have UC. You will have universal coverage.
This is the system in place in Thailand by the government.
Yes.
Right.
And then if you are employed, you will have social security.
Right.
Okay, so the social security is mainly for yourself.
Right.
Okay, and then if you are employed by some company or some special organization, they will provide you more benefit with the coverage, the health insurance. So in that case, you have social security and you have the health insurance. Or if you are employed by the government, then you are civil servants and government employee, you will have the coverage with the policy for the civil servant and then government employee. So basically, there are 4 health insurance. The first one is for every people,
right,
which is unemployed, you will have UC.
Right.
But if you have you are employed, you will have at least social security.
Right.
If you are employed by the government, you have the policy for the civil servants. If you are employed by the private company, some private organization, even with the Bank of Thailand or some organization, there is the special health insurance, and the final you can pay yourself. So basically, these are 5 segment
Right.
of the patient who come to the hospital.
If we talk about the management according to the social security system or social welfare such as Sirat Hospital, how is the finance work? Where is the main funding came from?
For the people who are in the social security, the employee have to pay one part, the government pay one part.
This is like in advance.
I'm sorry?
Is this in advance payment?
Yes,
or?
every year.
Right.
So to the certain
Right.
number, every year, yearly, you have to pay 1/3 by the employee, 1/3 by the government, by 1/3 by the employer. So this will go to the Social Security Fund, and then they will divide some part of it as a medical expense, some as for when you get sick or when you get old. So these are all managed by the Social Security Department. Okay, and then from the side of the hospital, every hospital will have the population, the catchment area. I mean the population that enroll into the system of the hospital. So the hospital will have the yearly amount of all those patients.
Right.
So we receive all these budget. Let's say Sirat Hospital we have 40,000 patients with the Social Security. So they will come to us with free of charge during the year. So
Right.
every year we receive the budget from the Social Security Department.
So in some hospitals, some private hospitals, they actually set up the special area designated for this group of patients
Yes.
only. Is Sirat also do the same thing?
Yes, we did. We do have a special unit, special area. But for Sirat Hospital, in this segment, we kind of remain the same. We are not increasing the number of the population because we position ourselves as a referral center. I mean, the tertiary hospital. So we do not have a wide base of the population.
Okay.
We work as a hospital that receive all the patient which are referred from other hospital.
Oh,
So basically, for the Social Security patient, more of the patient are referred. So in that case, we transfer the cost to the primary
to
hospital.
the original hospital.
Yes, right.
So does that mean that Sirat can call itself the center of the expertise because
Yes,
you've
right.
got referral patients
Yes. So
from...
that's what we call tertiary hospital. Supra, the higher levels of the referral center.
Can I ask what is the proportion of that group of patients from the referral compared to the overall number of patients here?
Not much. What we are now talking, we are talking about the Social Security.
Right.
The proportion is around 4 to 5% of our inpatient.
Okay.
But if we look at the other scheme of the health insurance, the UC,
Right, the universal healthcare.
which is this is applied to almost every patient who has no others.
Right.
If you have no others, like you don't have Social Security, you don't have a civil servant coverage or private insurance, you have UC. So if you look at this portion, the number will be almost 35% of our patients.
When we're talking about UC, is this the same one with the 30 baht
Yes, right.
payment?
Yeah, it's
So
the same one.
do these patients have to have some kind of card or some kind of registration in advance before they can use it?
You have to register in some certain hospital. So the difference between Social Security and the UC is for the Social Security you have to pay at least 1/3. The
Right.
employer pay 1/3, and the government pay 1/3. But for UC, government pay the whole.
Right.
See, and the system is almost the same because the government pay the whole, and then the money, the budget will go to the primary hospital, the primary healthcare service that will take responsibility of your sickness. Okay,
Right.
so if you got some sickness, you have to go to that healthcare facility first, and then they will do whatever they can.
They will see whether they have to transfer these patients.
If they have to transfer, they have to write down the refer documentation, then document and then just send you. So as Showreel Hospital, we are tertiary, so every day we got so many patients with all these refer.
And you can choose.
Well,
As a hospital, you can't really
Yeah.
choose the patient.
yeah, it's difficult to choose because our mission, our philosophy is we look at the necessity of the medical treatment first, and then we just look at the finance. We're talking about finance, right? And then let's say one patient is more suffer than the others. The first patient needs urgent treatment, and then the second patient is less severe than the first one. What we did is what we do. I mean, every day. So now today we're still doing this is to try to keep the
one with the urgent.
the one that need the treatments.
Right.
Well, if we compare two patients which has the same condition, then we look at the finance, the affordable, or the availability of our facility.
Staff, right,
And then
right.
sometimes we have to transfer them to a suitable,
Right.
of the proper facility. We have
They
them.
can provide
Yeah,
proper
yeah,
care.
yeah.
So when a lot of people talk about universal health care or social welfare, most of the people, of course, skeptical about the quality of the service. How can we ensure the quality of service that it's actually in the same standard?
I think most of all are really standard. I mean, if we, for this scheme, it was set up probably over 10 years, and then things are keeping change. I mean, the policy increasing every day, so we're not just doing the same thing 10 years ago, and the situation is getting better. So if we look at the standards of the UC in Thailand, I think it's very good. In the old days, 20 years or 30 years ago, when you go to the hospital, and they just don't have the system to refer
Right.
you. Okay, and then some people really suffer. But now, it's the pathway for the patient to go. The problem is the payment, which is the UC fund.
Right.
The fairness, the appropriateness of the payment to the provider. I mean, now today we are dealing with all these things.
Okay. So what is the reason that UC would need the designated areas, especially? Is it also because of the way the funding works?
Yeah. Because there are a lot of paperwork, a lot of register, there's a lot of back and forth of the communication between the hospital that take care of the patient and the hospital that funding. I mean, if the hospital in the rural area, they are the primary.
They are the one receive the fund from the government.
They receive the fund
Wow.
from the government.
Okay.
So when they send the patient to our hospital, we have to recheck the status, everything, and so they have to be transferred the fund. So the system is really good, but
Still too complicated.
The concept is very good, but
Okay.
the process is very complicated. So
Right.
that's why many hospitals have to
Just-
separate
right.
some departments, some location to do this, even in our hospital.
What do you think would make the system easier? Is it maybe have to redo the system, reconstructed the whole structure of the payment and funding system itself?
I think the
From the
government,
government?
the government is trying to do this thing. Last year, the government started to do a national clearing house, which is like a centralized all these paying scheme.
Right.
Three of them, at least
Right.
not the private one. Try to consolidate everything into one
The information
system.
and the process.
Information, but I think this is the way to go. But in the meantime, the process is still very complicated. And for every fund, every entity, they have their own regulation, and then the system is still have to be clarified, have to be simplified.
Talk about a patient transfer. What is the procedure for transfer patient between hospital through this healthcare system?
Basically, depends on the hospital.
It's not the choice of the customer, right? It's more like how the hospital talk to each other and see which one is more suitable.
Well, yes, because from the primary hospital that transferred to the second hospital, they will write the document. Let's say for the Social Security, we have the system we call the contract. So for Sira Hospital, we are the supra contract to. Last year we have 18 hospital, which is our contract hospital. So in this case, they will transfer patient to us, and then we recognize them as our patient. But other patients still can refer.
Right.
But in that case, the process is more complex because we have to ask back, and then we look at the patient. We will say, this is what we want to do, and then we have to ask them for permission to accept the cost. So this is more complicated. For that's the Social Security. But for the UC, almost the same, but for UC we don't have that contract. So the hospital in the public health ministry, they normally transfer the patient to the hospital in the public health ministry. But sometimes the patient want to go to us. So
because you wanted the best.
So the hospital doctor. So this is more or less depends on the doctor-patient relationship. And then,
so can I ask, what is the proportion of the patient that transfer from rural area or provinces compared to the patients in Bangkok itself here at Sirirat Hospital?
Not much nowadays comparing to the past. We would say 70-30.
70-30?
Yeah.
That's still a lot anyway.
70 is still the patient in Bangkok and vicinity, the surrounding area. Not really the patient, but still some come from up far north and south because they just want to see us, and some of them even drop their coverage.
Oh.
Because they want to come to see us.
Okay.
So in that case, if you don't have the transfer document, you have to pay on your own.
So if the primary hospital see that they don't really need to be transferred here, and they still insist they want to come here, they have to pay for that.
Because some of them say they can provide this kind of service,
Right.
but the patient say, "Oh, I don't want to do this. I don't
they
want to do the
pick this
surgery
one.
in this hospital. I
Right.
want to go to Sirirat." So in that case, you have to drop your coverage, and you
Right.
have to pay your own.
But that is also the question of the standards among public hospital in Thailand too.
I think all this depends on the development of the professional.
Right.
And then now we almost have the medical school in most of the region of throughout the countries, and we have almost 20 medical schools. And then for the government policy to build Thailand as the medical hub, we start the new, several excellence centers.
Right.
And then like in Bangkok we have Sira, Jura, Rama, Tipati, and then for the northern part, Chiang Mai, and then on the northeast, Khon Kaen, in the south, Songkhla. These are all the regional medical schools which can do as a regional center.
Talking about the emergency care unit, that normally hospital will have separate area for the patient under UC. How do you prepare? How do you make sure that it's totally ready if it have to be in separate area?
In terms of medical facility?
In emergency units,
yes.
And then like fast response or first response.
For the UC, for the country first, the countries there's a separate the Institute of the Emergency, which is designate all the service to every province and also to every regional hospital. So as the patient got the emergency condition, they have to go to the hospital as fast as they can.
Right.
So they can go in every hospital. The system will be covered.
Anywhere.
Anywhere. Yes.
So last question. When we talking about the social welfare and universal health care, what would be one thing that you think is priority that need to be improved for Thailand? If you have to pick one thing that needs to be improved for the social welfare, social security, and universal health care for Thailand, for the health system, what do you think will be the first thing that needs to be improved?
I would say the networking and the referral system. When we look at the referral system, we're not just talking about the transportation of the patient in and out. We have to look at all the capability of every hospital, the level of service. We have to know each other. So this is the most important thing. And then if we have that information in our hand, so we have a good system to refer in and out. And this will, improve the quality of treatment, improve the quality of life of the patient, and also with the investment, the cost of treatment, this is more optimal. Because if you don't need sophisticated or fancy treatment, you don't need to come.
Right.
And after you have all these treatment in the Sira hospital, you can go there. Right. You can go back to the primary hospital and have all the follow-up, everything in that hospital. The system is still on the way to develop. We more or less focus on the transportation, the document, but what we need is to build a very well-organized network.
But we are on the right track.
Yeah.
Okay.
Right.
Well, thank you very much for your time. Universal healthcare system has been actively servicing Thai people for more than 10 years, and it is still being improved to provide even more efficient service for Thai people. And until we see you next time in Thailand 2020, I am Tulip Naksompop. สวัสดีค่ะ